Before we even get there, let's tell you about the vaccination program. The rollout of that program for teachers has kicked off today. There are about 62 vaccination sites in Gauteng. Currently, the province has over 7,400 new infections. Gauteng Education MEC Panyaza Lesufi has received his jab at the Rabasotho Community Hall in Tembisa. And that's where we find eNCA's Heidi Jokos, who joins us now. And Heidi, Panyaza Lesufi going to the front and taking his jab, the COVID-19 jab, really signaling the start of the vaccination of education workers. What did the MEC have to say after receiving his jab when you spoke to him?
Yes, certainly, Tulas, and I think it's a move that we have been seeing amongst many ministers. Even when the vaccination rollout started with the Sisonke trial, we saw the president receiving his COVID-19 vaccine. So we do know that the MEC for Basic Education in the province, Panyaza Lesufi, receiving his vaccine today, as well as teachers and support staff in basic education in the province. Of course, this has been something that many have been waiting for. We have spoken to a number of teachers who have indicated that they welcome the move. They have been waiting in anticipation, given the exposure and what they go through every single day at schools, and also the really high number of COVID-19 cases that the province is currently experiencing. But the MEC just outlining and explaining how the process is going to work. Vaccines will not be administered at schools. They will be administered at about 60-odd vaccination sites in Gauteng. Some are only dedicated for teachers. For example, this one here in Tembisa, specifically just for teachers, where others are still administering the Pfizer vaccine, but it's a separate unit where teachers will be vaccinated. Principals and district managers will facilitate the scheduling to make sure that there's no disruption of schooling. Let's listen to the MEC of Education.
What we have done, we've, together with the Department of Health, identified sites across the entire province. So each and every site, we've done what we call mapping, school mapping, which simply means we link that site with the number of schools that are closer to that site. So what they need to do is just contact their principal, and their principal will tell them where to go. It has to be done in an orderly manner because we don't want to disrupt the academic programs, which simply means that it will be managed in a manner that is rotational, so not everyone will leave the school premises at the same time. Immediately after that, when they arrive at the site, they just need the ID, a copy of the ID or the driver's license, and if they've got the medical aid card as well, because some of the medical aids have an agreement with government to ensure that this information is collected for their members. So that's basically that, and I'm told it lasts not more than 5 minutes. Immediately after that, they will be escorted, just to wait for 15 minutes or so to check whether there are after effects or not. If there are no after effects, they will go back to school, and if there are after effects, then the medical team will provide the relevant assistance. There are additional sites for educators, exclusively for educators. Yes, in some instances, the sites that we're utilizing, we're sharing them with the 60-year-olds or above. The numbers of the 60-year-olds are going down because the majority of people have been covered. So it's not going to create any stampede or create confusion. All those that will be on that particular site, they'll be guided accordingly by the marshals.
So the target is ambitious from the Gauteng province, particularly around teachers, Heidi, with Panyaza Lesufi saying that they plan to wrap up the inoculation of teachers and education staff within 9 days instead of the 10 that has been set aside to sort of expedite and fast-track the immunization of teachers. But you also got the chance to hear from the Deputy Health Minister, that's Dr. Joe Pahla. What did he have to say about the situation broadly in the country, but as well as the situation in Gauteng and possible restrictions?
Yes, indeed, Tulas. I must just add that when we actually asked the MEC of Education, Panyaza Lesufi, about whether or not that deadline is going to be met, given what we have seen with the broader vaccine rollout and how we have taken almost 5 months to vaccinate just over 2 million people. How are we going to vaccinate over 500,000 in just 9 days? It seems as though the MEC is saying that everybody needs to heed the call and urgently get to vaccination sites so that it doesn't take up more than 10 days as allocated by the Department of Health, because other phases need to start opening up. But what's interesting is that the Deputy Minister of Health, Dr. Joe Phaahla, was also here to see how the vaccine rollout will proceed for the basic education sector. And we got a chance to ask him about whether or not other phases are going to open up, given the fact that they are seeing a lower number of those 60 and above, because most of them have already received their first dose of the Pfizer vaccine, and we are receiving more vaccines now. Before there were issues about the limitation of vaccines available, and it seems as though they will be announcing in the next couple of days that those that are 50 and above will be able to register on the electronic vaccination data system, and they will be able to get to vaccination sites to get vaccinated. This is a huge move in government's attempts to, of course, try and vaccinate as many people as possible. They have missed, I've even forgotten how many deadlines. So the pressure's on to get as many people vaccinated and, of course, to try and deal with the alarming numbers that we are seeing in the province. But the Deputy Minister is saying they are trying to deal with it, and there are ongoing discussions to try and figure out what they are going to do specifically in Gauteng.
All right, thank you for that. That's eNCA's Heidi Jokos out in Tembisa, watching developments there as the education sector workers, teachers and others who work in basic education line up to receive their jabs as that process gets underway in earnest.